gentlemen, I consider this a great honor to be here to welcome you all to this white coat ceremony. The distinguished dignitaries here present, the faculty, staff of All Saints University, all invited guests and well-wishers, gentlemen and ladies of the press, and of course, our white coat recipients. You all are looking amazing. Welcome to All Saints University 37th White Coat Ceremony. Can we give a round of applause for you are all experiencing a very historic event. Do you know why? Do you know why? Okay. This is the first time in the entire history of All Saints University that a joint white coat ceremony like this, comprising MD1 to MD4 students, and even MD5, some MD5 students, you know, in one occasion like this, celebrating you all. So, and to add icing to the cake, we are also currently celebrating the just accredited situation we had yesterday. You all were, the status we have got yesterday, we were announced to that we just got accreditation, and that's from the ACCM. So that is a plus, and that makes this even more historic for everyone. So can we give a round of applause to the management of All Saints University, as well as myself, because every student were part of that process. So once again, a round of applause to yourselves. My name is Emmanuel Eferro, and I'm going to be the Master of Ceremony today. The White Coat Ceremony connotes a rite or initiation into the medical career as student, which is symbolized with the gowning of the coats, of the white coat. A white coat represents a reward of hours of hard work and vigorous studying, but also a subtle reminder that there is more work ahead. It is a symbol that represents virtues of altruism, responsibility, duty, honor, respect, and compassion. Most importantly, it represents professionalism and trust. Let's remember the words of the Hippocrates, who boldly said that wherever the art of medicine is loved, there is also love for humanity. You're witnessing a historic history being made, a depolarizing moment by which every stimulus has led up to this point where we can cross the threshold and achieve maximum action potential with no refractory period. It is often said that a journey of 1,000 miles begins with a step, and I can say that these amazing white coat recipients have taken more than a step towards achieving what seemed impossible, this journey called medicine. But before we go into those amazing moments that we are all anticipating, I would like to recognize the dignitaries sitting at the high table. To my immediate left, we have Dr. Dominica, the Dean of Academics. Can we welcome her, please? Next is Honorable Peter St. John, the Minister of Education and Human Resource Development. Very much welcome. We also have Mr. David Abiodun, who is our registrar, the Registrar of All Saints University. We also have Dr. Basil Fadbe, one of our distinguished faculties, who is also representing the faculty at this occasion. I also want to recognize all faculties here present once again, and the staff and the pressmen and women here present, our invited guests, the parents, you are all welcome. And I always want to save the best for the last, the white coat recipient. Today is your day. Can you just smile to yourselves and just, compliment how good looking you all are? As we all know, respect is reciprocal, and to honor this wonderful island and its culture, I would like to ask Dr. Maria Fana to come up stage as well as we all rise for the national anthem of Dominica. Can we all rise, please?
I love beauty, I love splendor, I do all so sweet and fair. All surely gazing wonder at the gifts so rich and rare. Rivers, valleys, hills and mountains, all these gifts we do extol. Healthy land so like our fountains, giving cheer that warms the soul.
Thank you very much, Dr. Ofana. You may all be seated. Thank you very much. Back to the accreditation matters. You can now, message and contact some of your friends that are not on the island, and flaunt it to them that you are attending an accredited university. I think that makes this university even more prestigious. So that's the thing. I will continue to remind you all of this before we end this white coat today.
All right.
Okay, without much ado, let's give a warm welcome to the Dean of Academic Affairs, Dr. Dominica, to say a few words. A round of applause.
Thank you, Emmanuel. Good afternoon, ladies and gentlemen. Let me stand on the established protocol and once again welcome all of you to the All Saints 37th White Coat Ceremony. This semester we decided to change the whole format of our White Coat Ceremony so that from day one in medical school you will start appreciating the responsibility that the white coat gives you and your very special role in the society. The white coats that you'll be putting on today are very short, and they will stay short during all of your period in training. And this short length of the coat would represent always the limitations in your knowledge and experience. But at the same time, your white coat is still white. So it still represents enormous responsibility that white coat itself symbolizes. So make sure that you understand your responsibility in this society. You understand that your very special role is not a role of superiority, but it's rather a role of a lifetime learner and a hard worker. You today will put on your white coats, and we hope that you realize that this ceremony is not about celebration, though of course there is always a room to celebrate your personal achievement, because you got to the medical school and some of you got as far as MD4. That is really something to celebrate at the personal level. But at the same time, putting on your white coat, you take responsibility, and the ceremony is not so much about celebration, but about accepting and acknowledging your responsibility. A responsibility for hard labor ever since you put it on. I'm happy that since January 2019, the nursing program was introduced in our university. And from now on, our medical students can study side by side with our nursing students. Because till the end of your professional life, you'll be working side by side with nurses. And Nowadays, modern the care for patients is a teamwork, and a surgeon is not more important than a perfusionist or a nurse. Everybody has a role to play. During my time in the medical school, nurses will play a very important role in educating medical students. In fact, after my MD1, we all had to take 1 month of training under the supervision of a nurse. And this was graded, so you better pass it. Nobody dared talking back to a nurse, looking down on a nurse. Nobody dared questioning assignment. I was carrying out my duties during my practice in the intensive care unit for TBC patients. My first assignment from my supervising nurse was disinfection. This is when you come to know how medicine smells. And you do not dare asking questions. But it was a great experience, let me tell you, because during this month, I learned to perform all type of injections. I could easily set IV line. I could insert the urinary catheter. This helped me later on to work as a nurse during night shifts during my studies in the medical school, not for more practice, but also for extra money. So I am really grateful to that nurse that supervised me in my early days as a medical student. And I wish every medical student has this practice. It's really great. So when you put your white coats today, I want you to understand that healthcare and medicine on the whole is not about you and your performance. It's about care for patients. I wish you success in your careers. Thank you.
Healthcare and medicine is not about you and your performance, it's about care. And she also said, at all times, your white coat should remain white. Thank you very much for those words of wisdom and encouragement. Another round of applause for her, please. I would like to welcome to podium Honorable Peter St. John, the Minister for Education and Human Resource Development, for the dignitary speech. Can you give us a round of applause?
Thank you very much, Mr. Master of Ceremonies. Let me first of all recognize the distinguished members of the head table. I wish also in a special way to recognize the faculty and staff of All Saints University School of Medicine. And of course, most importantly, you, the white coat recipients who are seated here this afternoon. A pleasant good evening to all. On behalf of the government of the Commonwealth of Dominica and the Ministry of Education and Human Resource Development, I wish to extend deepest congratulations to you who are gathered here this evening to don your white coats, a rite of passage that signals that you are one significant step closer to your dream of becoming a physician. You are achieving this milestone at a time of great uncertainty in the world around us. In fact, you are entering the profession, therefore, at a time when you will have to consider even more than before the people that you serve, the issues that affect the lives of your patients, and the role that you play in improving their lives and bringing some level of comfort to them in such a challenging time. I commend you for your courage. In fact, to be a doctor takes incredible courage, determination, and a deep love for people. Caring for people and taking the responsibility for their health, for their lives, is no small undertaking. It takes a certain amount of personal sacrifice to make the decision to give yourselves to a life of service to your fellow man. This evening's white coat ceremony positions you to begin your journey as a medical practitioner who will offer distinguished, unselfish service to the patients who are entrusted to your care. The white coat denotes, or it will denote, a certain level of authority to the patients, and it speaks of professionalism and signifies caring and trust. It is a powerful symbol of compassion. And so I implore you, the white coat recipients, to always carry yourself honorably in a manner befitting of this honorable and noble profession that you have chosen. To the management of All Saints University School of Medicine, faculty, and the staff, I wish to congratulate you for this activity. An important date on your yearly academic calendar. In fact, as stated earlier, today's ceremony signifies the 37th white coat ceremony. That, to my mind, is a great achievement, and you must be commended for that. I must say that we have enjoyed a very warm, cordial relationship with this university, and indeed the Dominican people and the government are indeed delighted to have been part of this relationship. Today's ceremony holds special significance because for you here at All Saints University, I have been advised that this is the first time in your 13-year history, your 13 years of serious challenges, that we have the white coat recipients from three different MD1, MD2, and MD3. MD4. It means, therefore, that All Saints is actually growing. Today holds special significance, not only for you here at All Saints, but also for us as government, and indeed the ministries of education and health. I say this because the status of All Saints has undergone a serious change for the better, with the announcement by the Commission of Colleges of Medicine, or the Accreditation Commission of Colleges of Medicine, the ACCM, that effective the 31st day of May 2019, the All Saints University School of Medicine is now an accredited institution. I commend and congratulate you. In fact, I understand fully, members of the head table, the daunting task that you had in ensuring that your university was fully accredited. And I would hasten to add that I expect within short time that the Dominica Medical Board shall effect the process of granting accreditation to All Saints University School of Medicine. I believe that this is a significant milestone. It means, therefore, that All Saints can now position itself to fill the vacuum that has been created here on island with the exodus of Ross University. You are now at a stage where you can stamp your seal on the Dominican and Caribbean landscape as a university of prestige, a university of renown. We look forward as government to working with All Saints University in achieving this noble objective. To you, the young students, doctors, you have thus far demonstrated the sense of tenacity, discipline, character, and the passion that is required for you to be successful doctors. I therefore wish to urge you to remain true to your value and to the characteristics that will set you apart from the rest. I want you to go forth and herald the All Saints message. And I give you every assurance that the government and the people of Dominica shall continue to support you, and we wish you every success as you pursue your dreams and your aspirations in becoming world-class physicians. Again, I congratulate you on your achievement as a university of distinction. I commend you, the young doctors who are going forth. And remember, wherever this journey takes you, serve humanity with dignity. I thank you very much.
applause for the Honorable Minister of Education, Peter St. John. Thank you for your inspiring address. I'm sure these are words that the White Coat recipients and all well-wishers here will take to heart. These students, who I call the gladiators, have fought their way to this point. Please, a round of applause once again for yourself. I would like to agree with the Honorable Minister that All Saints is actually growing. I mean, consider the accreditation, to think that you students were all part of the growth process. That is actually remarkable. Let me take you all briefly to the university student traditional method of celebrating stuff like this. When I say of the greatest All Saints, you say great. So can we just do that briefly? Greatest All Saints? Great. Students, greatest All Saints University? Great. Greatest of the greatest All Saints University? Great. That's the spirit. Okay, it's a slogan that we normally have as students. So a round of applause once again for all the speakers we have. I'm sure that we've all been anticipating this moment amidst all the speeches, especially the white coat recipients. It is now time to present the white coats to these gladiators, like I would like to call them, who indeed are deserving and have worked hard enough to complete different stages of your medical education at this prestigious university, All Saints University School of Medicine. It is my pleasure to welcome on stage to do the presentation of the white coat, Dr. Mary Afana and Dr. Pawan Ladas. Can we give a round of applause for them? Dr. Oleski and Dr. Oha Puzurenko. A round of applause once again. And Dr. Andre Puzurenko. Let's keep applauding as they come up.
Good afternoon, everyone. Depending on existing protocol, it is my pleasure to call the white coat recipients. So I'm going to start with the MD1 class, and I'm going to call you out in twos, okay? All right. So the first on the list is Adams Michelle, followed by Kanaye. All right, so let's see here on the white sheet, that's it. Amifuna Chiamaka Stephanie. Welcome to Aruba. Sambo Albert Daniel. David O'Connor. Equipment Michael. Imelsa Asante. Ide Unsaridem. Idowu Ibrahim Olabisu. Jackson Carbellari. Johnson Shalom Emmanuel. Olomuro Olakunle. Olusamade Oyidamola. Oluwadade Oluwabukola.
Should be mindful. Yeah.
Oscar Sapuri. Okonkwo Anita.
Congratulations to all our white coat recipients. A round of applause for yourself. Can we just celebrate them once again, please? You all look incredible. Thank you very much to the faculties that assisted with that. A round of applause once again for these white coat recipients, please. Let's celebrate them, please. It is not an easy journey indeed. Now I would like to call on stage Dr. Olha Puzoranko to do the Medical Student Pledge of Ethics. I would like to ask all white coat recipients to stand. Thank you.
And I will neither receive nor give unauthorized assistance on examinations. I certify only that
which I have personally verified, and will never receive or give unauthorized assistance on examinations.
I will value the knowledge and wisdom of the physicians who have preceded me.
I will value the knowledge and wisdom of the physicians who have preceded me.
I will recognize my weaknesses and strengths, and strive to develop those qualities that will earn to the respect of my patients, my colleagues, my family, and myself.
I will recognize my weaknesses and strengths, and strive to develop those qualities that will earn the respect of my patients, my colleagues, my family, and myself.
I will respect the humanity rights and decisions of all patients, and will attend to them with compassion and without bias.
I will respect the humanity rights and decisions of all patients, and will attend to them with compassion and without bias.
I will maintain patient confidentiality and be tactful in my words and actions.
I will maintain patient confidentiality and be tactful in my words and actions.
I will value the diversity of patients' experiences, cultures, and beliefs because it enhances my ability to care for them and enrich my education.
I will value the diversity of patients' experiences, cultures, and beliefs because it enhances my ability to care for them and enrich my education.
I will not forget that there is an art to medicine, as well as the science, and that wants sympathy and understanding are integral to patients' care.
I will not forget that there is an art to medicine as well as a science, and that warmth, sympathy, and understanding are integral to patient care.
I will strive to earn the trust my patients place in me and the respect that society places upon my profession.
I will strive to earn the trust my patients place in me and the respect that society places upon my profession.
I will recognize the privileges afforded to me as a physician in training and promise not to abuse them.
I will recognize the privileges afforded to me as a physician in training and promise not to abuse them.
Even as a student, I have a responsibility to improve the student standard of health in my community, to increase access to care for the undeserved, and to advise medical knowledge.
Even as a student, I have a responsibility to improve the standard of health in my community, to increase access to care for the undeserved, and to advance medical knowledge.
As I accept these new responsibilities, I will not forget the importance of my own health and well-being.
As I accept these new responsibilities, I will not forget the importance of my own health and well-being.
I will continue to value my relations with those who have supported me in the past and those who will share in my future.
I will continue to value my relations with those who have supported me in the past and those who will share in my future.
Knowing my own limitations and those of medicine, I commit myself to a lifelong journey of learning how to cure, relieve, and comfort with humanity and compassion.
Knowing my own limitations and those of medicine, I commit myself to a lifelong journey of learning how to cure, relieve, and comfort with humility and compassion.
I make these promises solemnly, freely, and upon my honor.
I make these promises solemnly, freely, and upon my honor.
Congratulations to all.
Thank you very much, Dr. Orho Professor, and congratulations once again to the White Coat recipient. During the gowning, someone mentioned at the back that you all made it. I also want to agree with that person because I understand how those biochemistry pathways look like at times, and the ascending and descending tracks of neuroscience looks like. So believe me when I say I get you. Congratulations to you all, and this is just the beginning of the journey. Now I would like to join me as I welcome upstage from the faculty, the representative of the faculty, Dr. Basil Falipe, for the faculty speech.
To the Honorable Minister of St. John, thank you very much for coming. You've been a very faithful ally to the university. I think the university has every reason to be grateful to you. For as often as I've been able to attend ceremonies on the campus, I've always seen your constant presence. Thank you very much. The registrar, whom I will call the glue to the university, that holds everything together, almost impossible if it was not there. I think we need to give him a standing ovation. Thank you very much. Dr. Basenko is a lady that I've come to grow to respect quite a lot. She's a very focused lady, very determined. As she was giving her dean's address, I could catch from the voice. As she was talking about her experience under the nurses, I could visualize her, you know,